Hello. Today we will be talking about the Ebola outbreak in the Congo and the role of the state medical officer. So I would first like to explain some facts about the Ebola virus. It is a rare disease and can oftentimes be fatal, and is caused by an infection of the virus group genus Ebola virus. Typically, for humans, there are four main types of this virus. There's Ebola, there's Sudan, Typhorus, and Bundibugai. For transmission, the only thing you need to get infected by this virus is to come in contact with somebody else, whether it be human or animal, through their mucous membranes. Typically, the animals that are infected are bats and primates, and you could also get the virus by coming in contact with objects that pierce the skin, such as needles or razors that have the infection on it. The signs and symptoms include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained hemorrhage that, if not treated, can lead to death. After contracting the virus, it typically takes between 2 and 21 days after contraction, with an average of 8 to 10 days. Persons that are infected will develop signs and symptoms, but they might not be contagious until they contract or until they show these symptoms. So you can contract the virus, you won't be contagious, and then once you start showing signs and symptoms, then you're contagious. And you will remain contagious following recovery. So after you recover, you may still be contagious in isolated parts of your body. If you have open wounds or scars, they can have the virus without you actually having the symptoms of a fever, headache, the hemorrhagic fever. You can still be contagious in those isolated areas without having the virus throughout your body. So first, I just want to explain what my role is as the state medical officer. In general, not just for the Congo, but any state medical officer would generally coordinate with healthcare professionals, as well as the local and state authorities and the CDC, to create a game plan, and they would implement that depending on what the epidemic is, how the disease is spread, and various factors that you typically involve the local region and public transportation. We would also analyze data and look at the current disease trends and epidemics so that we can properly analyze that. We also provide advice and support in order to reduce and prevent the spread of disease. We would also work with other healthcare officials for this plan, and then once the plan is implemented or established, we would execute it and make sure that we have the appropriate funds to supply both the plan and the people in the area. Such plans would normally include contamination of the area, would normally involve the isolation of the area, of the contaminated area, and uh, basically finding the most common spots of public transportation and finding a way to limit the spread of disease through those areas. So with regards to the Ebola virus in the Congo, what I would do specifically is I would first contact the local officials and find out where exactly the disease is most prominent and uh, figure out how we can isolate that. So once we establish that, I would contact the Center for Disease Control and discuss the appropriate procedure for the new outbreak. So after doing that, uh, we determined that uh, finding these different spots and isolating them using camps and tents that have the appropriate equipment to shield off the disease from the outside area. Build tents that have proper hydration, a food supply, and uh, and personal protective equipment for the workers. We would ensure that the workers coming in and out of these tents have all the equipment that they need in order to appropriately treat the patients, and also the workers that are actually going in. We would want to make sure that they're properly trained themselves, not just as healthcare professionals, but properly uh, treat the disease and uh, make sure they can isolate it. Uh, One thing we want to stress is that we want to make patients feel comfortable and we want to limit the spread. If we can accomplish those two things, then I feel like this whole problem will be mitigated pretty quickly. Well, we hope. Uh, so after doing that, we want to make the presence of the disease aware for the surrounding countries so that they're aware of people coming in and out. Uh, and we would also warn transport employees and people that work at the airports so that they are able to spot the signs and symptoms of Ebola. And that way they can contact us and we can make sure that they get the proper help that they need and that they limit the spread of disease. So once these quarantine camps are set up, it's going to be important to both tightly monitor the new cases and make sure that these tents have the appropriate equipment that they have and that it's still coming in. So if they run out of the personal protective equipment, if they're running out of water, we need to make sure that that problem is solved before it even happens. We also want to make sure that there's no stigma associated with the disease. The last thing we want is for people to hide that they actually have Ebola because they're ashamed of it, because the people in the communities don't want to feel shamed for it. So part of the campaign, probably most likely using flyers, will be to limit the stigma and just spread awareness. And lastly, we would temporarily limit travel for those coming in and out of affected areas, just so that we can reduce the spread. Lastly, I would work tightly with very closely with the health educator. That way, first thing that we do, health educator starts making speeches to the public in health in very prominent areas such as uh, such as schools, public parks. We just need to get the information out as fast as we can and ensure that everyone understands the consequences of having Ebola and not being treated for it, so that they could tell their friends and family, hey, this is serious and you could die from it. I think the more we make it known, the quicker it will resolve. There is a vaccination that has proven to be effective with clinical trials, but it's not licensed with Food and Drug Administration in the U.S. But we plan on staying current with the research, and hopefully that vaccination will prove to be safe and healthy for people, and we can reduce the spread of disease. Lastly, we would monitor other countries that acquire Ebola. That way we can learn from them and actually assist them when they need help. It goes both ways. The more we learn from each other, the stronger our impact will be in treating and mitigating this disease. Well, I hope you learned from this presentation, and have a good day.